So the Delta variant's a little different than what we were dealing with beforehand. So that's just a little bit about cases. We talked about the Pfizer clinic at the onset of next week. We opened up the return to school testing to get our kids back into school at Monday through Friday at the Hamilton Street Boys and Girls Club, 9 to 12, looking for that negative test to get back. I want to talk about it more just because it's not being utilized as much. And I know everybody's hearing stories, but we're getting 40 to 50 people a day there. We thought we'd be getting hundreds of people a day there. So again, Monday through Friday, Hamilton Street Boys and Girls Club, 9 to 12, for kids who need that negative test, or faculty that need the negative test to return to school. Certainly you can go on our website, sign up for the link there, but it's here. We've been doing it for a while, and the demand doesn't represent the proportionality of what we're hearing in the community, so we just want to get that word out there more. Next week, we'll come out with a new community testing location in partnership with Quadrant Biosciences. We're just finalizing the logistics on the location right now, but this will be a symptomatic testing location. Think about what we did at the F-Shed last year, so that we can continue to meet the demand. We're hearing that from certainly pediatricians and whatnot a lot. So we'll have another location next week. We'll come out with the location. We think we have the location. We just don't got a lease yet. So as soon as it's all set and done, we'll come out with that. And then in a COVID response related topic, next Friday we'll release a COVID response fund RFP using American Rescue funds to address human services needs in the community for those that have been disproportionately impacted by COVID. Just giving notice for that. Certainly we know that our young and our elderly residents have been impacted dramatically. So for our human service partners, this will be an opportunity to participate in an RFP to get additional funding for programs that will help us address COVID impacts, and that pot of money will be $1 million. So that's where we are with that. Happy to take some questions.
All right, we're seeing an uptick in deaths in the last couple of weeks. What do you make of that?
Yeah, I just, the virus is brutal on those with underlying conditions specifically, and anytime you have the influx of cases turns to hospitalizations to ICU, that's unfortunately we're going to lose members of the community, and so I'm very concerned about the two clusters in the nursing homes. We saw how this played out in the first and second wave, that when those buildings get impacted, that we lose people, and so that's obviously very concerning. And again, we've had mask mandates since day one of the Delta coming to our community in these facilities. So, that's something that's very concerning.
What have you been told about the nursing home cases in terms of, was it brought in by staff, was it unvaccinated residents, or the only people that can be unvaccinated now? What do you know about the story there?
So the state's the regulatory authority there. They're going to investigate that. They are investigating it. I'd be assuming, but again, most of your residents and those demographics that are going to be in a nursing home are your highest vaccinated demographic, right? So you're probably talking about it being brought into the facility one way or the other.
Even though staff might be vaccinated now?
That again, I could be wrong. I'm making an assumption, but it's an assumption based off of 18 months worth of experience in this topic.
What are the case numbers in each case of the nursing homes?
Usually we'll consider a cluster anything really over 5 that we can tie to one. These are much higher than that. I think we're talking about, and again, when I say a cluster, you're talking about staff and residents, but these are double-digit numbers for both facilities.
Does the county have a plan that they're going to be announcing, or that you're planning to discuss with healthcare providers and other stakeholders in the community for rolling out vaccines for kids heard from one pediatrician in the last couple of days that said he's concerned that there hasn't been any communication of a plan, if there is a plan, and where might these be distributed? Is it in school? Is it a combination of school and a mass vaccination site?
Yeah, I think that would be how we would start out, Mary, is again, we anticipate probably the earliest where the emergency use authorization will be granted by the FDA is probably around Halloween. We've gotten pretty good at this. It doesn't take 3-4 weeks to have that. What we'll do is we'll use the existing infrastructure and just use it for a different target audience. So if you recall with high schools and certainly junior high, we had vaccination clinics in the schools. We'll do that again. Certainly with 5 to 11, we're going to need probably a guardian. The logistics will be a little different. We had guardians and parents in high schools as well, big kids. But again, you're talking about, I have little ones, and I know when they're getting a shot, it's not the best moment in their lives. So that's something, and again, it will be parental choice as well. So I think we'll do things in the schools. We'll do a mass vaccination site, but also the pediatrician office is going to be probably a more comfortable setting for some of these kids. So we'll work with our local pediatricians on distribution of vaccine as well.
What do you say to the pediatrician who could represent other views of other pediatricians in Onondaga County that are worried that they are so backlogged with regular appointments and other vaccinations for just things that you need to even go to school or go, do normal life? What do you say to that?
Yeah, so if again, we're not going to push off this process onto them. So again, it will be an all of the above strategy. If a certain family care practice can't participate because they are too backed up, then that's fine. Then they'll be able to get the vaccine in schools or another vaccination clinic, and you'll likely have pharmacies as well in the game here too.
This isn't something we've talked about in a while, but the supply chain for vaccines, does the state still give it to the county, and would the county give it to these pediatric offices?
Correct, and some of the family care providers and offices have the ability to request directly from the state as well.
County Executive to Testing, will that new site be open to the general public as well as school children and faculty?
Correct.
When do you hope that opens?
Next week. Yeah, we need it open.
And I can only speak to actually interviewing people with this understanding, but is there a chance that Boys and Girls Club isn't being used because it is strictly for people whose symptoms have resolved? Because if it's allergies or colds, symptoms can last for a week.
They can, and so we're trying to, we're going to address that other symptomatic side with this new location, but we still do think that there's folks that qualify under this effort that aren't using it, and so we just want to continue to message that.
Would you still say it's successful in getting kids back to school at this point? I spoke to a couple people who went to the clinic today saying they were getting their results back pretty fast, and that it was different from what they had seen, but some of the nurses had said they are not seeing the people they thought they would.
Yeah.
But would you still call it successful?
Yeah, I mean, there's kids getting back to school, right? What we're again with we know the quarantines, and we know kids are getting sick. I sound a little stuffy because I actually, you can get sick and not have COVID. I tested 4 straight days, so these things happen, right? And it's going to continue to happen. So we just need to have the infrastructure built up to address it moving into the flu season too. So obviously we want to encourage people to get their flu shot. That's important as well to help avoid strains on medical infrastructure as well. This has all been about, if you look at 2021, second wave, Delta wave, everything has been about keeping your ability to treat your sick in your community open and successful. And even when we had 500 cases without vaccines, and positive rates almost at 10%, we were still keeping our society open because we knew how to keep that medical infrastructure going. So that's complex, right? It's not just about COVID. It's now we're going into the flu season. We're dealing with shortages and burnout on our infrastructure with our people. So it's all, that's the goal here. Learn how to live with this virus, because it's probably not going away for a while. And do it in a way where we can protect our vulnerable and treat our sick. And so it's very complex, and at times you need to do more things than, and other times you don't need to do more. So it's finding that balance.
And going back to schools, we are learning more about some schools thinking about remote or hybrid options as we're seeing cases increase. And you have spoken pretty candidly about the fact that kids need to be in school, they need to be learning in school. That's the best thing for kids in Onondaga County. Have you been talking to these school districts? Syracuse has talked about possibly looking into hybrid learning. What is the county doing to help?
Yeah, I think overall, if the conversation is like what happened in Liverpool, where you're running into a workforce shortage and you need to do it temporarily to get people off quarantine, I think that's something that's common sense. If the concept is that the risk to being in-person learning is too great to be in-person learning, we strongly disagree with that. So I think it depends on where that's coming from. Again, we have, as you reported on over and over again, we do pool testing, right? And so we're testing at least 2,800 to 2,900 kids, asymptomatic kids, in the buildings. Would we like to do more? Sure. But that's a pretty good sample size. And out of that sample, the data is remarkable with how consistent. I mean, you're talking about 1 week 11 tests, the next week 12, the next week 12. And the last week I think there was 7 or 8 schools that had a positive. One of the schools had 4 out of the 12, right? So what we're learning is that it's not spreading in the schools. That doesn't mean school-age kids aren't getting it. They're getting it. They're getting it through daily living activities for the most case. And like I said, they're getting it at home most of the time. And so it's complex. But if people need to go remote for a period of time because they don't have enough teachers, that makes sense. To suggest that right now, when our active cases are probably 15-20% of where they were at the peak when we had kids in school, that it's a risk-based approach, then we strongly disagree. The data doesn't merit that.
Back to vaccinating kids. We could, in 2 weeks, have the emergency use authorization to start vaccinating younger people. Is the county ready when that happens? Are they ready to deploy shots in arms of kids?
Yeah, I think that's going to be the one thing that hopefully what we're seeing, and I'll knock on wood, but hopefully what we're seeing is the cases flattening, okay? I thought they were flattening 2 weeks ago, and then we had a bump. But they're pretty flat right now going into the weekend. And then what could really help change things is that your number one demographic in the community that's unvaccinated can be vaccinated, right? And so that will provide a level of immunity. And so we'll put all of our infrastructure into that effort and continue to give the booster as well. But that will be an ongoing effort, because that's what, today 48% of the cases are under 29 years of age, right? So, and that's been pretty consistent. So what that represents is your 20 to 29 is your second least vaccinated population, and your 12 to 19 is your first least vaccinated population, and then you have your 5 to 11s that can't be vaccinated yet, right? So this is where the virus is really found, this pocket in the population, and that's where the cases are. So if we can get your 5 to 11 demo, there's many parents that want to get their child vaccinated. We should see results, just like we saw results quite quickly in the beginning of the year when we started giving out the shot.
When that approval comes, though, you will be communicating to the community and to doctors' offices and drugstores and wherever this is going to happen, or can you share details before?
Well, we're not going to get in front of the FDA, right, and assume the approval is coming, but if history repeats itself, we'll be watching closely. We'll know when that meeting is, and we'll be prepared to share the plans shortly thereafter.
Do you put that much emphasis on unvaccinated kids as the reason that this wave right now continues? What else can you do to break this cycle if vaccinated adults kind of have peaked out and the weather's getting bad? And how do you get the community out of this just status?
Yeah, I think there a couple things. I mean, there's as this thing goes on longer, there's more and more conflicting data on some of your mitigation things that have worked, right? And certainly, the vaccine's been so effective because look at where our hospital numbers are, and our hospital numbers are flat, right? If you could look at a chart, they're not going here; they're flat. One day you'll have a little bump, one day you'll have a little low. To Glenn's point, we're losing people in the community because they're getting sick and going to the hospital in the ICU room. But I think when you look at the cases and you look at what can you do? We have this ultimate contagious variant, so it's gone through every part of the country right now, and it looks like it hopefully it's peaked a little bit now here in the Northeast. Some parts of the state are doing better, quite frankly, because their vaccination rates are higher, and secondly, all of the testing in the community is being counted for their data, and ours isn't. And thirdly, comparing New York City to us is crazy. Think about all the natural immunity in New York City and through the various waves and everybody who's already had COVID. So we never we've been able to mitigate this thing where we didn't really ever get crushed. The second wave was very difficult. The first wave, if you look back at it, what was difficult was we were shutting down a society and mitigating, and then we were trying to restart, right? I think our high case day in the first wave was like 60 cases. When you look at it, there's certain tools that you can use, understanding that you're dealing with an extremely contagious variant that you're not going to be able to mitigate to zero. It's just it hasn't happened anywhere. And some of these communities have had the most severe restrictions across the world, and they still couldn't keep their data as closely to zero as they wanted to. And you see some now, Andrew, some of the countries that had zero policy, COVID policy, New Zealand and some of these other countries, they're abandoning that because they're realizing that this is a pandemic today that could turn to an endemic. We're looking at a couple things we can do if this doesn't flatten out, and we'll probably give it a little bit more time because the weather's giving us a little bit more time, as it's a beautiful day and it's going to be a beautiful weekend. But certainly we need this thing flattened going into the indoor season, and we've always given out guidance for mask wearing indoors, especially when you have people who are going to lots of people. And we've mandated mask wearing in all congregate settings, and we gave out the guidance for schools and daycares as well. So there's always some of the tools that people want to go to that we used in the past. We've already done some of that, and it's very difficult to enforce that. Anytime that we say there's a mandate, there's an expectation that we'll enforce it. But we're certainly willing to do more if this is not flattened out soon.
Any executive, are you aware of any local hospitals requesting or receiving state help with shortages from the vaccine mandate at this point? Do we know St. Joe's, Upstate, Krause, are they getting help?
Not yet, to my knowledge. And I think that what we really need to look at with the problem coming, and we're voicing this to the state now, is the nursing homes and long-term care facilities, and then the direct correlation with home care. Right now, the nursing homes, my understanding is they're not accepting a lot of new residents because of the challenges they have. And so that puts a lot of pressure on your home care ecosystem and infrastructure. So we're very much watching this, and we're very much trying to get in front of what that challenge could look like. And then we also have, with constraints at the hospitals, we also have EMS issues, right? Just providing basic EMS services on the timely basis that we normally want to. So these are all challenges that aren't necessarily being driven by COVID. It's being driven by, 19 months into COVID and really the fatigue and the workforce challenges our medical infrastructure is currently facing.
Are you working with the state to try to get them help?
We are, and we, again, when you have a mandate, you gotta have a plan, right? And, or you gotta be able to enforce the mandate. And so, mandates, you know, whether you love them or not, but if you have a plan on how to address the negative impacts of a mandate that we all can agree on will be an impact, then that's, at least you got a plan. So, we haven't seen the problems in the hospitals yet. I'm really concerned about the nursing home facilities and the home care medical infrastructure.
How's contact tracing compliance?
It's better. It's better. You're still going to have problems, and you'll still get people who are talking to you now, but maybe not telling you the truth, unfortunately. But
Any fines given out?
I don't think we've given a fine out yet, Mary. I think the no answer calls have gotten better, and so that's good, you know. But overall, whether someone's being honest with you, I'm not going to pretend that people are always being honest with us, because they're not. There's no way to prove that.
We've got a busy weekend ahead, SU Parents Weekend, we've got a game, we've got festivals and things. What is your message to the community about being safe this weekend?
Yeah, I think, look, at outdoors is always better. You know, and when people are with, especially as the weather shifts and people are going to naturally be more indoors. What we saw last year was when the zones came, COVID got worse, because you took regulated businesses where people would go into them, then they went into their own homes, right? And you saw a lot of household spread. People should be smart when they're indoors, and you know, if you're sick, it's probably not a great idea to go out that night. And certainly utilize some of the infrastructure that's been built up. It will be better, right? But one of the things that the president's pushing on the federal government is at-home test kits. Certainly, those are things that people should be able to take advantage of, these rapid tests, as a way to identify if they're, you know, a carrier. So I think this will all help. But the reality is we need to live life, and so we have to use the tools that we have and the infrastructure that we have, and we have to be smart, but we still need to live. This isn't going to go back to where this was in March of 2020.
Change the topic. Monday's Columbus Day. I wonder how you stand on the removal of the statue.
Yeah, I think overall, Glenn, I think we were going to talk about this. They got Glenn the question. All right, so I don't think the process to date has come to a conclusion that's going to unite the community. And that would be, I don't think just removing the statue brings people together, and to have a real dialogue about what that statue represents to different groups of people. Saying that, I also think there's an opportunity to do more in that circle, to really have a historical conversation, especially where we are uniquely, right? We're here, you know, land that the Haudenosaunee and that this rich history. So I just don't think where we are today, and again, I haven't seen what the mayor's plans are, but just having the conversation to take down the statue without trying to do more and propose more options, with some of those options being the statue still being there. You can have another statue there. I think Congressman Katko had a really good idea about having a statue of Hiawatha right next to the Statue of Columbus. I just see this being a divisive issue in the community right now, and certainly one I think we can do better on.
How would you do better? Like, what's your idea? Cat has an idea. You have an idea.
I like Katko's idea. I don't think that Glenn, you have a situation where when someone sees that statue today and is offended by it for different ideals and different reasoning, other people, specifically the people who are county residents, look at that and that means something different to them, right? They don't. That's not why that statue was put there. It was for the reasons why that other person doesn't like it. So is that an opportunity to try to really have a conversation and put out various options to the community and get community input. I think that's kind of it, but I like Caco's idea.
You would favor leaving the statue up and putting one on 511?
I think I would like to see more proposals of what the Columbus Circle will look like, and some of those proposals should include options where the statue still is up. Yeah, I don't have a black or white position on keep it up or knock it down, right, or take it down, right. But I do think that to say that right off the bat, and my goal is to unite the community, right? Right off the bat, that you're going to take something down. That's not going to. You're going to alienate a whole lot of people. And the same people that put that statue up for reasons other than what people are rightfully critical of Christopher Columbus.
Do you plan to be at any of the celebrations in the Circle and at the On Center, the Monument Corporation?
So I'm being honored by the. I'll be at church with this Saturday, and then I'm being recognized for a leadership award. Unfortunately, I have a conference on Monday out of town on a committee I serve on for the National Association of Counties, so I won't be at the luncheon for that reason, and that reason alone.
So you would be going if you weren't out of town?
Yes.
They don't give you Columbus Day off, the association?
No. No. Economic Mobility Conference is a great group of county leaders from across the country working on poverty initiatives. Yes?
Real quick, back to schools. Some school districts adding the position of COVID coordinator to relieve the burden of principals and superintendents from contact tracing and everything that goes along with it. Your thoughts on school districts having a COVID coordinator position?
Smart. I think it's smart, and I think it's until you see some of these demographics vaccinated and they're young kids, you're going to have quarantines, and you're going to have cases, and you're going to have quarantines of adults, right? So to be able to put that together, manage that, capture that data, and so that our team can look at that data, that's very helpful. I think it's very smart. Anything else? All right, folks, have a great weekend. Enjoy the weather. What do I do?